Hi. Good evening, everyone. My name is Krittaka Soha, and I'm a currently study master student at Krittaka University in Thailand. Today, I will discussing how to apply machine learning for predicting HIV infection among young men who have sex with men in Thailand. So the first of all, did you know the rate of HIV infection among key population is much higher than the general population, and increasing the HIV testing has shown a rising trend, especially young men who have sex with men in Thailand. I think this highlight is a urgent need for innovative solutions like machine learning to address this public health challenge. My objective to develop machine learning model for predicting HIV infection among young men who have sex with men through the Universal Health Coverage Program in Thailand, and to assess factors associated with HIV infection among young men who have sex with men. In my methodology, we include men who have sex with men aged between 15 to 24 years old through the Universal Health Coverage Program from 2015 to 2022. And we have variable include all risk factors including age, HIV testing, year as HIV testing, and HIV routine testing. We categorized as those who has 1 or 2 tests per year and those who has more than 2 tests per year. And other is regions, non-occupational post-exposure prophylaxis, number HIV testing, partner or people with HIV, and people living within core system. Study outcome is HIV infection was classified as people with HIV and people without HIV. And in part of statistical analysis, we perform characteristics as a descriptive analysis and comparisons among groups were used chi-square test and Wilcox sum test. Machine learning approaches were developed for classification of HIV infection, and the last one, factor associated with HIV infection were interpreted using logistic regression. And this workflow is showed the brief of developed machine learning model. So we have the key steps like data collecting, data cleaning, and data splitting, model selection, model performance evaluation, and feature important. So we have to divide the data set into the training and training set, and we use synthesis minority oversampling technique, or we know in the name SMART, to address this imbalance in data sets, and machine learning we use including kernel-less neighbor, random forest, and extreme gradient boosting. So I have to evaluate model performance by accuracy, sensitivity, specificity, and area under the ROC curve. This result has shown a total of 146,813 young men who have sex with men were included, and 11% were diagnosed with HIV infection. The median age of HIV test was 20 years old, and 74% had a routine testing 1 or 2 times per year. And most of men who have sex with men were from northeastern regions, followed by northern and Bangkok. This figure has shown a decreasing trend of HIV prevalence by year group from 2015 to 2022. After we developed the machine learning model, the extreme gradient boosting achieved the highest performance in predicting of HIV infection. And also the extreme gradient boosting algorithm identified the top 3 important predictors based on the feature importance score, including routine testing followed by years and age as HIV testing. In the multivariable logistic regression model, men who have sex with men which age between 20 to 24 years had a higher risk of testing positive for HIV compared to those aged 15 to 19 years. Young men who have sex with men who had 1 or 2 tests per year were more likely to test positive for HIV than those who had more than 2 tests per year. Additionally, young men who have sex with men who were tested for HIV between 2015 to 2017 and 2018 to 2020 has higher odds of HIV infection compared to those who tested during 2021 to 2022. Our study predict HIV infection demonstrates effectiveness in detecting HIV infection among young men who have sex with men using the real-world data set. This study has no information of HIV exposure and sexual behavior risk, which might have an effect on HIV infection, and also a class imbalance in data set within only 11% HIV case. Even we use the small or significant minority oversampling technique to address the problem, but may affect to a robustness. So I think this finding implies that the application of extreme gradient boosting model in the real-world datasets could be useful to estimate HIV prevalence, to plan for target intervention, and for implementation of prevention programs. Thank you.